friend. My name is Christina Rofano from NursingSchoolOfSuccess.com, and this is the third video in a 5-part video series all about nursing exam questions and test-taking strategies for nursing students. This is a super fun series because in each of these next few videos, we're going to dive into one nursing test-taking strategy to help you rock your nursing exams. Plus, I'm actually going to walk you through an example nursing exam question in each video. So before we get started, make sure that you're subscribed to this channel so you don't miss out on any other nursing school tips and tricks. Trust me, you don't want to miss everything that I've got coming up for you. Now, let's do this. Okie dokie, so the nursing test-taking strategy we'll talk about in this video is that patient safety and the nursing assessment dominate. So let's talk about what I mean by that. So oftentimes in nursing exam questions, there will be a case scenario question that walks you through a patient situation, and then it will have you select what you would do if you were in that situation. And of course, it will give you a list of answers to choose from. And oftentimes, that list of answers will include something you'll need to assess for. The nursing assessment is the first step of the nursing process, and it is one of the most important things you will do as a nurse. And so oftentimes on your nursing exams, you will see an answer to a nursing school question that would have you assess something further with the patient. And this assessment component or this assessment answer often has something to do with patient safety. So here's what I want you to remember. If there is an answer to your nursing school question that includes assessing something on the patient and that assessment also keeps the patient safer, I would bet dollars to donuts that that is the correct answer. So if those two things are paired together, assessment and patient safety, then friend, that is most likely the correct answer. So let's walk through an example nursing school question and kind of bring this all together. This question comes from the NCLEX RN Mastery app, and this is the app that I super duper highly recommend that you use throughout nursing school to help you get more familiar with nursing exam questions and how they test. The more you practice answering nursing school exam questions like these, the more confident you will be when you actually have to go and take your nursing school exams, and you'll be better at identifying these little nursing exam hacks too. So it will make your exam experience go a whole lot smoother when you're more confident and you can identify these little nursing exam hacks that we're going to talk about. So make sure that you download this app right after you watch this video because it will help you out just so much in nursing school. I did put an affiliate link down below for that app. And just a little disclaimer here, if you do decide to purchase this app through my affiliate link, I will receive a small commission at no additional cost to you. Of course, friend, you know that I never, ever recommend anything that I do not love. So this app really saved my life in nursing school, and I know it will do the same for you. So that link is down below if you would like to check it out. So like I said, the nursing test-taking strategy we're going to talk about is that if there is an answer to your nursing school question that includes assessing something and that assessment also keeps the patient safer, then most likely that is the correct answer. So let's read an example nursing school exam question. The nurse prepares to infuse pack RBCs into a client with anemia. To limit the likelihood of a type 2 hypersensitivity reaction, which action does the nurse take? Have epinephrine ready for injection as needed. Request that the blood bank divide the unit into smaller volume bags. Administer diphenhydramine 30 minutes before the transfusion, or carefully check identification of donor, blood, and client. Now, looking at this question, you can already see that there is one answer that asks you to assess the patient further. So that is step one. Now, step two, you'll need to ask yourself, does this assessment help keep the patient safe? And in this question, the answer is yes. So of course, you want to make sure that you're carefully checking your patient's identification and making sure that it matches up with the donor blood. You don't want to give your patient the wrong blood. Come on now. So check the ID. So yes, this answer meets both of those criteria. It involves assessing the patient, and it does keep the patient safer. And that is your nursing test taking strategy to help you with your nursing exams. If there is an answer on your nursing school question that includes assessing something on your patient, and that assessment also keeps your patient safer, then friend, that is most likely the correct answer. And make sure that you snag the NCLEX RN Mastery app to get access to thousands of nursing exam questions just like this one. This app is amazing. You don't want to live without it in nursing school. There is a link down below for you to snag it. And don't forget to subscribe and hit the bell to get notified when we post a new video. Thank you so much for watching, friend. Now go become the nurse that God created only you to be. And I will see you right back here next time on the Nursing School Show. Take care.